Hello, everyone, and welcome to Loop and Learn's T1D speaker series. Today, we get to hear about a, a very interesting app called Happy Bob, developed by Jutta Haaramo, who's a T1D mom and a developer. As usual, we'll talk about our disclaimer, which is basically the Loop app is a do-it-yourself closed-loop algorithm, and you take full responsibility for building and running the system, and you do so at your own risk. A little bit of updates for what's coming in the future. Loop and Learn activities. We have two coming up. One is Loop Dev Build tomorrow night, Monday night, October 24th, to target our friends who are outside of the US. So we have time zones that are a little bit different for us. It's via Zoom. You're free to watch how we build Loop Dev or build along with us and get help if you need any. We are also building a loop-friendly provider resource, a list of healthcare professionals who are loop friendly, loop knowledgeable, or possibly even loop experts. If you have a healthcare team who support you in your looping adventure or understand looping or actually know how to run loop, and you're willing to share within our community, please let us know. Go to the loopandlearn.org site and recommend an HCP. And we have at this point over 200 listings in our resource, and we would love to add your suggestion if you have one. Adam Brown, author of Bright Spots and Landmines, is a type 1 diabetic, and he developed the very, very popular 42 factors that affect blood sugar. He's been working in the diabetes space for quite a while for Diatribe and Close Concerns, and he is now a registered associate marriage and family therapist, currently working with the Healthy Teen Project, serving teenagers with eating disorders and those living with type 1 diabetes. We're looking at the impact of living with type 1 diabetes and the emotional effects and mental health. And I've been saying since a long time ago that type 1 diabetes is basically an impossible task. It's something that a human brain can't comprehend in its entirety, and it carries with it an emotional burden. And that's one of the reasons we're looking at Happy Bob today. There is an emotional burden, and I think it's very important that we acknowledge it, particularly with the young folks who have type 1. And then for what's coming up in 2023, if you have something you'd like to see, please let us know and we will set up presentations. So I'm going to move on. Let's talk about Happy Bob. Most of the admins in Loop and Learn have downloaded the app and have been playing with it recently, and we actually formed a group. So we are aware of each other's data, or CGM data, and we communicate that way, and it's been very interesting. It's a secondary Dexcom CGM display. It delivers your glucose values alongside messages with some of the many characters that are available to you, so you feel more like a person, not a patient. Jutta says diabetes extracts a huge mental toll, and the app is designed to alleviate the data overload involved with the daily care and glycemic control. It's here to make your day better, and this partnership with Dexcom makes Happy Bob better able to do that. It was started in 2018, designed to make self-care with diabetes more fun, humane, reduce the mental load. It can kind of make you smile when you see the app. It's available on your watch. It's available on iOS and Android, and in 6 different languages. And you'll be hearing from, I'll say this correctly, I hope, Jutta Haaramo, who's a co-founder and CEO of Harald AI, as well as a co-founder of Stylewhile, a Finland-based fashion tech company. Her oldest son was diagnosed with type 1 diabetes in 2014. And from that, she developed a team to build Happy Bob with her background in gamification and using humor. And we've enjoyed it. We've got a team going that we just look at each other. We are supportive. It's a really interesting app, and we've really enjoyed playing. I don't want to say playing because it's real life and it's what we do, but I hope you enjoyed the presentation. Thank you so much for working with us on the time, and it's all yours.
Thank you so much, Joanne, and very nice to be here. And thank you so much for having me. I really appreciate it. I know it's an early morning for you, so thank you so much. And so I'm just going to start sharing my screen here. I actually don't have a very long presentation. I was kind of like hoping that maybe as we speak, we can, if you have any questions, we could just go them through while I'm going through this presentation. I thought the kind of way forward could be really just giving my story and the story of HappyBob and why we started to do this, and just I would love to hear your comments, any thoughts you might have. And yeah, obviously everyone here in this group has a lot of experience with type 1 diabetes. I'm sure a lot more than I do. So I really value all the feedback you can provide and any thoughts you have to share. So the name of the app is HappyBob. The name of the company is Harald AI. We really wanted to start from the feel like a person, not a patient, just because of the fact that everything with diabetes comes with such a huge amount of data, and that can be really overwhelming. I certainly experienced that myself when my son was diagnosed with type 1 diabetes. I to be honest, I knew almost next to nothing about type 1 diabetes, and I was just like amazed how overwhelming it can be. And really, honestly, I felt that the whole experience of having someone diagnosed with diabetes comes with this sort of like assumption that everyone automatically is an engineer, is into techie stuff, and loves to look at Excel sheets like day and night. And I personally just felt that it was kind of like adding on top of everything that came with diabetes diagnosis, kind of like the obviously, when you have a child being diagnosed, you really want to make sure your child is stays as healthy as possible. But then the amount of data that comes with diabetes really doesn't, in a way, make it any easier, because it can really feel like it adds on the burden instead of reducing it. So that was sort of like where I was coming from, and then. So my background, I used to work for a mobile games company back in like in the early 2000 until 2010, I think, and that experience sort of really has stayed with me ever since. And the kind of way experiences are built, digital experiences are built in a way that they are very user-centric and sort of engaging and fun for the user. So that was kind of like something that I instantly just that felt natural to think about it, like what would this experience look like from my son's perspective and from my perspective, if it was any kind of easier and somehow more even fun for us. So here's a picture of me and my son in the hospital after he had been diagnosed. It was actually Halloween. So we thought that we're just going to go there for a very quick visit, because he had been, the classical peeing all night and being very thirsty. And we just thought that I think, no, we were supposed to go do trick and treat right after that visit to the hospital. And then we got to stay there for one full week. And it's kind of like one of those moments when you really wouldn't want to know in an instant. I think they took his glucose at the reception and told right away, oh, he has diabetes, you have to stay here for a week. And sort of like a bit too quickly, even you get the diagnosis, you wish it took a bit longer. So you'd have maybe more time to adapt. And and so then obviously everything, we got I think we started with the manual glucose meters and insulin pens and the kind of traditional stuff, and then later I moved to Dexcom and Omnipod and other devices. So yeah, so just a bit of the background story. And but today where we are with the HappyBob app is that the app is available in the US currently. So Joan, as you mentioned, it's on iOS and Android before. We actually launched the very first version of the app already in 2019. Back then, we were using the Dexcom share API and kind of like getting the data through that sort of like unofficial way to the app. And back then, we were also supporting people around the world basically with the HappyPop app. But currently, due to the regulatory reasons, we are only available in the US. So we are FDA Class 2 exempt device, secondary display for continuous glucose monitoring, meaning that we need to follow this very strict regulatory requirements for medical devices, which is something that means that we no longer can do this as sort of like a side project as how this started, and something we kind of like really first were just building for ourselves with the early prototypes and kind of like doing something to make our lives a bit better, then the lives of other people a bit better. But then as soon as you kind of enter the medical device field, it becomes a lot more complicated, and that's what we've also discovered. So we're currently a small team of we're 6 people working with the app, and like mentioned, we have the iOS and then the Android app, and we also have a website where people can log into their data to see their CGM data and also their insulin intake if they're using the HappyPop app for that. And back in March last year, we announced the partnership with Dexcom. And so I guess the kind of reason why we so the kind of in the very early days, we just really thought that the whole experience of diabetes, I thought that it would be easier for us to manage my son's diabetes if we were able to get the perfect analysis of all his data all the time. But kind of like with time, we also discovered that it's not just about the kind of having the perfect piece of information always, but it's also kind of like just how you cope with the stress and this kind of very monotonous experience of constantly managing your condition. And it just becomes like you sort of like start not to pay attention, definitely like children who have hard time of sometimes accepting they need to go through everything that comes with diabetes, this kind of like constant management, and also the fact that diabetes comes with a lot of pain, which I think is never really discussed, because every single injection obviously it hurts, and I kind of like I've been amazed that it's so overlooked and not kind of like discussed, that no one wants to be pricked by a needle all the time, and it kind of like that part of the kind of equation is not sort of discussed maybe enough. So we kind of like started to think that even though we started in the very early days, we started with this kind of like building the most perfect algorithm and having all the data. So we had this very senior data machine learning people working with us on this task. And then we realized that, well, first of all, the competition is, or there are already so many great companies working on those problems, and it's very unlikely we could actually deliver something with value when it comes to creating better algorithms or like whatnot. And also, since some of the very early prototypes we did, we tested this algorithm where we could extract the right insulin dosing recommendation based on the past data of my son's glucose and insulin intake and activity data, and just ended up like discovering that that's like very risky. So I mean, obviously there would be all these clinical trials, but that's something we just wouldn't even want to go there. So we started to think about the other part of whole diabetes management and the kind of mental burden that comes with the condition, and just like understanding how my son has been very into drawing his emotions and kind of like he was coping what he was going through with some of his drawings, and kind of like picturing how he feels with the different, when his glucose is high or low or whatever has been going throughout the day. And that's sort of like all this together kind of like turned out to be the HappyPop app experience, where, and I'm maybe just, so here are just some of the kind of problems we were seeing. So that the diabetes self-management causes such a huge burden on the patient was one of the kind of very self-evident things we were discovering. I, as a parent, was feeling that, but certainly my son was experiencing that too. And then we also felt that a lot of the existing solutions were really focused with the data tracking, but as such, they could even add on the burden instead of reducing that. And there wasn't really the kind of, that kind voice that would encourage you or say something nice or make you just feel a bit better, like a friend would do. And then another problem we also were seeing that the people with these conditions, they are just not really motivated to take an action. Like, obviously, if you're really want to take good care of yourself and are this kind of like quantified self kind of a person, and driven by data, then you're going to do whatever you can. But there are a ton of people who are not that kind of people, and who wouldn't necessarily be just encouraged or motivated by the numbers and looking at their data. So they might need a bit different kind of approach. So we really just thought about those people, and I kind of like, I guess I would more fall into that category. So just looking at pure numbers wouldn't be as kind of like motivating for me as kind of like having a bit more sort of like an experience around the kind of whole experience. So this is where we were starting from, and then, well, this is what the kind of looks like at the moment. But in between, there were some of the kind of key sort of discoveries for us. That first of all, that when you're like, whenever you manage to keep your glucose in range, you're already succeeding. And that's why we wanted to show the glucose readings as stars. So whenever when you use the HappyPop app, every star here on the line is a glucose measurement, and that always is a star. And if you're keeping your glucose in range, you're actually collecting that star. And that was kind of like one of the very sort of early discoveries that we should really celebrate each and every time you're keeping your glucose in range. So that's why the whole experience with the HappyPop app is built around the stars. So you keep your glucose in range, you're earning or collecting a star. Then the other kind of like key idea was that there should be some sort of like a message related to that reading, so which could bring value to you. It might kind of like prompt you that, hey, maybe you need to take an action, or there would need to be something kind of like a bit of relevance related to that glucose value at the moment. So that's why we have the message field in the HappyPop app. And then we also wanted to bring this sort of like friendly face to the experience, so that they would be kind of like, you're kind of like interacting with your data. It's funny that you're interacting with your data, but you're also interacting with the HappyPop app, and it's kind of like all coming together with this very sort of strange way that you have your data, you're talking with your data, but there's also the app that's commenting you about your data. And so what we do with one of the kind of key features with the HappyPop app is that we send notifications based on the real-time glucose readings to the user, so that whenever you're keeping your glucose in range, you're collecting the stars, you're receiving these notifications that tell you how well you're doing. So you kind of like, we really felt that we want to notice those kind of like wins, and not just like the times you need to do something. And the other kind of key part of the experience is that we send a notification when your glucose is about to get high or about to go low, and we send those automatically. But the kind of message is always delivered with this the tone of voice you have. So there are multiple personalities in the app, and you can always choose the kind of personality you want in the app, and then the message related to your glucose is delivered along with the tone of voice from that character. This actually came from when we released the very first version of the app in the App Store. a fellow T1D mom reached out to us and said that, oh, you have a really nice app and it looks beautiful, but the messages are really dull. And so it turns out that she's a writer. And so together with her daughter, who has type 1 diabetes, they came up with Snarky Bob. And we said, well, that's a wonderful idea if you're able to write. I mean, we're not native speakers. I mean, I'm not native English speaker, so I'm definitely not a writer. So if you're able to write the messages, we'd love to add those in the app. And so they came up with Snarky Bob, and we just added that as a tone in the app, and users were loving that. And we've been actually working with this with Samantha and since then. So she's a very crucial part of the team now, and it's been over almost 3 years now we've been working together. So really glad we got connected that way. And so here are just like some of the kind of key views on the Apple Watch. And why I'm showing Apple Watch here is that we're actually seeing from our data that a lot of our users who have an Apple Watch are very actively checking their glucose values. And like we know from every single study out there, is that the more you engage with your data, the better results you're getting. So it kind of like goes hand in hand. And we're also seeing that the amount of so actually the people who start with the with glucose with not like kind of a perfect time in range are actually benefiting a lot of the Happy Pop app use as well. But so when these are just like here's the example of the notification you'd be getting when you're using the Happy Pop app. So you get your glucose value is 75 here in the first picture, your number is steadily dropping. Maybe you should have a snack. So that's delivered when your glucose is, it looks like it's getting below range. Then when your glucose is below range, Bob turns purple. And then when your glucose is above range, Bob turns yellow. And when your glucose is in range, Bob's always blue. And so regardless the mood you select in the app, the colors always stay the same. And so some of the other features we have are obviously the group feature, which you were Joan, you mentioned, and that's something we kind of like started as an experiment to see if that's something that people would like to use. And now we're hearing from quite a lot of people that they actually do enjoy using that quite a lot. And we're now thinking about like what are the next ways to make the feature more valuable for people, so that so there are like some people have been asking for that there could be a chat functionality, and there are a lot of different ways it could be improved. And at the same time, being a small team, medical device, there are only that many things we can be working on. So I would just love to hear how would you improve the groups feature if that's something you find useful. And we also connect with the insulin data, and I was thinking that I could just like quickly, I don't know if you've tested that in the app. So you can either manually insert insulin doses. You can also see your activity data in the app. So just by tapping on the 3 pillars here in the main view, you get your activity data in the app. And then if you tap on these small dots here in Bob's message, next to Bob's message, this is only on iOS, you can see the different, so how many steps you've taken that day, what's your average glucose that day, how many stars you have collected, and so forth. And then every morning you get a notification, the morning notification that tells you how many stars you collected the previous day, and if you have reached your star goal. And again, this message is delivered together with the kind of tone of voice you have selected in the app. So I think we have like, today, I think we have thousands of different messages available in the app. So here, just like I thought this might be interesting. This is something, this is definitely not a clinical trial, but this is just like our own observations. So we see that the people who use the app, and if they start with kind of like if their average collection of stars is between 50 to 200 stars per day, they are in 10 weeks improving significantly. And the reason for that, and what we believe and what we're hearing from the users, is that people are with this experience, they are more engaged with their data, and when they're more engaged, they're paying more attention, and they're just taking the actions more likely than without the HappyPop app. As one slide about the current user demographics. So we asked this information in the app. So currently, the biggest age group are people under 18 years old. So obviously a lot of children, and that's kind of like where we kind of like started from. So just from our own experiences. So us being here two moms with kids with type 1 diabetes, but we're seeing also a lot of type 2 diabetics using the app, and kind of like really, and our own sort of like assumption is that we're kind of reaching that population who is not necessarily, or who might be using you know, like these data driven apps already, but who just want to have a different kind of like a more fun, more sort of like a playful experience with their data, and that's really the kind of aim with the HappyPop app. So we believe that this is kind of like, you can still be using Night Scout or whatever, and HappyPop is kind of like just providing this different view of your data, and hopefully providing this more encouraging and motivational aspect to it. So currently, how we connect with data is that we have obviously the Dexcom real-time API, meaning that we get the real-time data from Dexcom, and people can connect the HappyPop app together with their Dexcom data. We also provide the Apple Health connectivity for insulin, glucose, and activity. But again, with glucose, obviously, the main source of glucose data is for Dexcom. Then we have some users who are using HappyPop with the InPen. So they're using InPen that writes the data to Apple Health, and then HappyPop is retrieving that data from Apple Health and showing that in the app. We also have a connectivity with the smart insulin pen using NFC, but that's something we haven't yet launched. And in the future, we hope that the way we see the kind of where HappyPop stands in this whole ecosystem is that we really would want to provide this user-centric, fun experience around whatever data people with diabetes have and how they want to follow that. And then that would be the kind of position for us. So we just make that data a bit more interesting, a bit more fun, and hopefully add this sort of encouraging aspect, and maybe a bit of this kind of community aspect to that experience, so that people don't feel the burden of diabetes quite as hard as they might do otherwise. So that's really the aim we have. And we're also thinking about like what other data is relevant for people with diabetes, and that could mean more data from the Apple Health, but at the same time, coming from the background that we really don't want to add on the burden. So we just really want to carefully think that what brings value to the user. So this is just around the kind of connectivity with data. When it comes to how we're building the app moving forward, we're actually looking at some very different things and experiences. So we're very soon introducing a new feature in the app called Awards, meaning this kind of like very playful, fun experiences around your data. The users could collect awards when they are succeeding in their daily care, and kind of like collecting their own targets. So we're super excited about that. I hope I will be able to share more updates on that with you soon. So and about the kind of other projects and clinical trials. So we're currently piloting HappyPop with the Children's Mercy Hospital in the US, and that's something we've been part of for quite some time now. We don't have any results just yet, but we're really excited to be part of that pilot. And then we're also starting a clinical trial now with the Helsinki University Hospital here in Finland. So that again will be for children with type 1 diabetes under the age of 16. And in the very early days, and what kind of like has kept us going for quite some time already has been the very supportive feedback we've been getting from the I guess mostly from the other parents with kids with diabetes, and then posting about the app and kind of like telling us about HappyPop to other users, which really kind of allowed us to build the early user community and kind of like has been keeping us going, because to be honest, this kind of when you're working with anything that comes with the medical device and the regulatory status, that's easily very time consuming, and the process can be very slow. So the user feedback is definitely what has sort of like kept us going, and we're so thankful for all these users who have been providing feedback and just like sharing their experiences to other users with diabetes. And here are just like some of the comments we've been getting from our users. So most of the times it's really the kind of providing more sort of like fun experience around data and just making it a bit more easy to carry. And that's really where we want to be. So we kind of like want to take a tiny part of the diabetes burden away with the HappyPop app. Here's a quick look at our team. So we have a small international team working on this app, and I thought I could just maybe give you a quick look into the dashboard we have. So this, John, I don't know if you've seen this yet, but this is basically and so I don't have diabetes, so this is I'm actually wearing a CGM now, but so here I guess you all have seen the app now, so that's something you're more or less familiar with. So we also have this dashboard, and the kind of reason why we built this, and so I'm wearing a Dexcom. I do have diabetes, so that's why. And I actually just started the Dexcom today, so my values are very flat. But so what you can see here is that I just like so if I add with my HappyPop app, if I add a insulin dose here in the app, it will appear here. So this is one way to look at the data. You can also go back to whatever date you want. If I had more data here, I would also see the kind of my data for the past 7 days and how many stars I've been collecting and what the average glucose value has been. We also show the calories burned. This data is coming from Apple Health, so it's available here as well. I don't know, Joanne, had you seen this before?
No, I don't think I have.
Yeah, so it's it can be accessed from our website, and just go to dashboard and to US, and you can. That's another way just to look at your data.
So I'm curious how you're funded, or is everyone volunteer?
Yeah, so we have private investors funding the company, and so just angel investors behind the company. So we are like, as soon as this becomes a medical device working with the regulatory side with the required insurances, building the backend as it should. It's unfortunately something that is not something that could be done as a volunteer side project anymore.
So whoever your ministry is of devices in Finland, are they accepting of this? Are they encouraging?
Sorry, who are
your ministry of your FDA in Finland, whatever your equivalent is?
Yeah. So currently, according to and so the reason for us not launching HappyWop in Europe is not actually regulatory reasons as such, or the EU MDR regulatory reasons, but there are other reasons for that. Currently, HappyWop is classified as a non-medical device in Europe. So as long as we display data without doing any analysis based on data, it's not classified as a medical device. So we're definitely moving forward in the launch in Europe soon as well.
I wanted to just comment on two things you mentioned. Yes, there's very, very little discussion about the pain. And even as adults, if you put in a pod and it hurts, or a sensor, you're not supposed to say much because it's, kind of get over it. You're going to do this anyway. But there is pain, and I appreciate your even commenting on that. And the majority of type 1s are not data people. So also terribly, terribly true. Have you thought of putting it available, and I don't know how this even works, on gaming consoles? There's seem to be some young adults saying that they don't want to look at their watch or their phone, but they want something built into a gaming front end. Has that come up?
That's interesting. I actually haven't heard that before, but that's that's super interesting. And I guess I mean, if we had the endless resources there, we definitely could look into that. Currently, with this tiny team we have and the regulatory requirements, we're just like really focused with the kind of existing platforms, so the iOS and Android, and for now we don't have any plans. But I think that's definitely a super interesting idea. I know Minecraft has been doing something with type 1 diabetes, so that's a very interesting idea.
We have a young man in our community who's been teaching himself programming, and he gets annoyed when his mom comes in and says, have you looked at your phone? And so he's been building an app into his console. I don't even know what that means, but I will connect him to you. That way you'll just see his direction. It's kind of interesting. For as little as I understand. Who is Bob? How did it get named?
Yeah, so that's a good question. And so I think the kind of very early versions of the app, we had this. So first there was just a smiley face, and then we kind of like built or drew a circle around the smiley face, and then thought that, I don't know why we started to think that it's like a blob, and that you always just want to keep him happy, because that's what you just need to do. And then I don't know, just like it became Bob, and so he's like no one and he's everyone, and that's kind of like we just want, it's like be like Bob. So whoever, it's no person, it's kind of like anyone could be it could be anyone's data.
Well, it's interesting because you have a Karen in face as well.
Yeah. Yeah, so it's kind of like it's been a bit risky with Karen, because there are like some people who are who don't maybe find it so funny, but yeah, Karen is no kind of like a character as such.
Yeah, it's one we look at and go, oh, no, maybe, but no.
Yeah.
Are you working to get access to Abbott Libre 3?
So from our perspective, and the way I personally see is that every person with diabetes should have control over their data and use their own data in the devices they want to use, as long as the devices obviously meet the kind of regulatory requirements. And so really from that perspective, we would love to support any CGM out there, any insulin pump, and kind of like just it should be the user's choice. So, but we don't have any plans at the moment.
They don't play well with others, so that is part of the problem. One of our members said that they couldn't find it in the App Store in Canada, so I don't know if you are planning that or there's an issue there. But he asked, how does he find it in Canada?
Yeah, so currently we only support Dexcom real-time API in the US, and that is the reason we are not available in the other app stores, since the experience is really working the best with the CGM data, the real-time CGM data, and all the experience is kind of like built around that. So even though there's a way to add manually your glucose values, we're rather waiting until we have the Dexcom connectivity in the other countries as well. So currently we only have launched with Dexcom real-time data in the US, but hopefully soon in Canada as well.
Okay, they're watching. And are you cleared to run the G7? Are you one of the partnerships with Dexcom for the G7, or do you anticipate any problem?
We currently don't have any information to share on that, but I hope we will be able to support G7. Obviously, I think it's a major improvement, and really looking forward to seeing one myself, or actually wearing one, or having my son to wear one. So they're not launched in Finland yet, but in many other European countries they are. So it looks like it's going to be here soon.
How exciting. I'm going to throw this to our admins who are on today. As we set up a group, which has been really an interesting experience for us. I think there are 6 or 7 of us who are sharing our data in a Loop and Learn group, and I don't think any of us have shared our data in real time to a group in the past, and it's an interesting experience. And I welcome any of the admins who are on here to unmute and just say what your experience has been on this, and or concerns or things you like. It's interesting, when we started the group, one of our admins was celebrating her birthday extensively and said, I can't start sharing today because I just ate ice cream. And the answer was, that is a day in the life, so you share it whether it's a good number or a bad number, and that's a hard thing to get over. You only want to share the flat days.
I know, and that's wrong. That's definitely something that no one should be ashamed of, but it's but we totally understand that. That's why we actually have been thinking that maybe there should be a way, and some people have actually asked if there's a way you could just share your step count instead of the glucose value, just because you might want to share something but not necessarily your data, and that's obviously should be totally fine as well. So yeah, but love to hear your thoughts.
Well, if you have a bad day or a bad sensor or a bad pod, you're getting bad numbers. And you want to say, no, I don't want to share that. And I was trying to look for a way to shut off my data flow until I got it back under control, which isn't realistic. But it is that sense of, I don't know if it's shame. Priscilla, Mike, Carol, Phil, do you have any thoughts on whether it's embarrassing?
I'm the one who ate the ice cream, but I have to say that it wasn't doing ice cream. It was deciding to do it at the last minute, not even pre-bolusing for it. So I knew it was going to be terrible. And, but actually it's interesting because you have the space for the messages. And I think maybe a chat would also be great. I got to say, then I ate oatmeal the next morning because I was over not eating because I'd already done the ice cream, and oatmeal always makes me rise. And I said, okay, here comes the oatmeal spike. And, it was actually, I really enjoyed watching everybody else and seeing the real life stuff. We had people who had just started sensors and they're all wonky for us at the beginning. I also really liked seeing how we're all so much in range because of Loop. It was heartening to see that although we're all alive human beings who have real life stuff, how really well we're doing with diabetes. And it was just nice to be able to see. You know what I would really like to see, and this is probably a strange kind of request, but I'd like to see half stars or something for between like 125 and 150, because I feel like I'm doing, if I'm eating a meal and this is real life, I'm going to hit 150. And I consider that for right after a meal with carbs, not bad. But I lose the star. And in this competitive world right here, it's very cutthroat.
Yeah. That's interesting. So we really be thinking about, like, should there be more sort of this like ways to, like, if you've been in range for like even longer period of time, you'd be getting even extra stars, and if I hear you right, we should just really think about kind of like bringing more variability to the stars.
Yes.
Very good feedback. Thank you.
I haven't added it to my watch yet, but Priscilla showed hers and I thought, that's cool. That would be fun to see. It just, there's not a lot of fun with type 1 diabetes other than mastery of your glucose or apps or your closed loop algorithm. There's not a lot of reward. And this is the first thing that has felt really fun. And simple enough that it was just, okay, this is okay. It's cute. It's colorful. It's not very deep. It's not insightful other than you get to see it and you get to see your friends and you worry about them. I saw someone last night run to 200. I'm going, wonder what happened there. I just wonder if they're okay. And so for me, it's just been a kind of a fun experience. Diabetes is not fun. So it gives me that opportunity, and I love this. Feel like a person, not a patient. That's a hard line to follow, and very much appreciated in my little world. So,
and it has been a very competitive experience watching you all interact and monitor each other's activities. But to make no mistake, this is a very active group, right? We've got people exercising and going out to eat and living very big lives, and still managing somehow, some way to stay within a modest range of control. It's amazing.
I guess. Sorry, go ahead.
No, I see it as an amazing tool for teens and young adults, because that's where we lose kids who are struggling to care. And if they have friends that they've met at camp or any place that are also type 1s, it just may give them a source of communicating for themselves and still stay engaged. I can see this as a tremendously useful resource in that age category.
Yeah, we really hope so. And now your feedback has been so extremely valuable. And since you are an active group, and I would just like to ask if you're interested in, or I'm going to email you as soon as it comes out, but these new awards that I think are going to be like the next level of fun, if there can be fun in diabetes, because they will be these awards you can collect whenever you're keeping your glucose within a certain range, if you're like meeting your star goal. And it's sort of like this really nice looking animations within a gallery, and then you can, certain awards you can collect multiple times, and you can kind of like, we really want to build on this rewarding experience, because everyone with diabetes is doing so much work all the time, and it's not being appreciated at all as much. Like, you go and see your endocrinologist and they might just like pay attention to all the times you did not succeed without seeing kind of like all the times you succeeded. So we really hope that this rewards, the awards gallery and experience will kind of like sort of bring that appreciation for people with diabetes for all the work they are doing. So I'm just going to as soon as it's available for testing, I'm going to email John you and let you know, and maybe your group wants to try it out as well. We'd really love to hear your feedback.
Yeah, it's really interesting. You work really hard. Those of us who work really hard with diabetes and our self-management, there aren't rewards. The reward is you don't die, you don't get sick, you don't get complications, and it's a long-term goal. But that's not, yes, it's a reward, you live, but it's not a feel-good reward. You're not given $10 in your bank account, you know, or something, and this gives you something. I didn't think much about it until paying attention to this, so I get it. I understand that.
I'm so glad to hear you kind of like you see value in this, because to be honest, when you're building something like this and you're all the time thinking, well, this might be just our experience, maybe it's just like me and my son and a few other people, and then it's so important to hear from others as well, that is this making sense, and if there's something that's not making sense, so we can take an action and to correct those as well. So just very much appreciate your feedback.
You get into lockstep. Okay, I have type 1 diabetes. Okay, I have to do this. Okay, I'll do this. Okay, I'm doing it. You don't stop to go, this is hard, this is difficult, this is not a feel good. You know, the only feel good I get is a flat line, and that's a stretch to feel good about flat lines. So and we're adults. The admins here are adults. We don't always act that way, but we are. And if we were kids, we'd say, why? What is it? So I'm looking forward to seeing the awards. That'll be fun. I thank you for what you've done. When I was reading a little bit more, you were featured with Diabetes Mind Innovation Summit as an unusual approach, and I highly respect who they choose and who they highlight. So thank you for what you do. Thank you for staying up late for us and working with me on this. And we look forward to just continued engagement with you. That would be wonderful.
Thank you so much. I really appreciate your time, and I'm just going to let you know as soon as the awards feature is out there. So if you have the time, and try it out and let us know what you think. I would love to hear. And thank you for having me. Really nice to meet you. I hope one day to meet all of you in person.
Oh, we'll come visit. Thank you. Thank you. We will have this edited and up and running, and really appreciate the work you've put in. It's been an experience, a fun experience for us.
Thank you so much, and thank you for all the work you do. I know, like Loop and like looping and the whole do-it-yourself community is like, it's a major kind of like the kind of forerunner when it comes to diabetes innovation. So I thank you for all the work you are doing.
Thank you.
It's really remarkable.
Hope you have a wonderful week. Thanks so much.
And thank you. Thanks. You too.
Bye-bye.
Bye-bye. Bye.
Bye.